All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today is Tony Gentilcore, who's been in the personal training and strength and conditioning field for over 20 years now. And before we get into anything, I need to let you all know that this podcast is now sponsored by Ascent Protein. Ascent is a brand that is one of the better ones that I've been able to find that has all whole ingredients, organic products, and I am someone that doesn't tolerate whey and dairy all that well, and so I actually started using the vegan protein that they have, and as chalky as most of them are that I've tried in the past, this one is probably the better one, or one of the better ones I've found that tastes good, has a good amount of protein in it, and easy to digest for me, and just has made getting my protein a little bit more easier. So if you'd like to learn more, go head to their website, ascentprotein.com, or check it out in our gym, where you can find it on the shelves. And so, Tony, thank you for coming on today. It's a pleasure to have you. It's been, you're someone that I looked up to as a college student when I was first getting into training and learning more about strength and conditioning, and Chrissy's Sports Performance was all the rage back then, and blogging was a big thing. So reading your articles,
the good old days of where people actually read stuff.
Yeah,
that was nice.
Tony has been a longtime blogger on T Nation. He has his own blog on his website, and you've been in this for a long time. So you had your own gym for a long time, your own little studio, and now you've expanded to the Core Collective that you opened with your wife, which is a collaborative wellness center that spans various healthcare professionals. And you have quite a bit of publications within the continuing education realm for trainers as well, and really emphasize coaching skills for long-term success over just these basic sales tactics. So,
yes.
I want to start by, asking you, I guess, it was actually a real eye-opener for me when I came, because I had listened to you on someone's podcast, maybe it was Mike Robertson.
Sure.
And you were talking about having just opened your small gym in
and
in
you saw it. It was pretty small.
And so
calling it a gym is not really studio, or whatever, or apartment. I don't know what we want to call it.
It was really interesting because I thought I heard you say you opened like a 12,000 square foot facility, and then I walked in, I was like, what, I think this is 1,200 square feet.
Not
maybe.
even. I think it was 500 square feet.
Yeah. And it was like, okay, here's this big guy that like has this big following and this, T Nation, like big writer and very knowledgeable and everything else. And for me as a student, like looking at like the strength and conditioning path, I was like, wait, is this it? It was kind of like very eye-opening of like, okay, like I thought Tony was rich and, had all of this money to open this big business with the following he's created, and really made me realize like, oh no, that's not it. But you can also be very successful with your training in a very simple manner.
Sure. I think it was more to do with commercial real estate prices in the greater Boston area.
For sure.
I think that dictated the size of the studio I was able to open. Because Cressy Sports Performance is a rather big place, but that's out in Hudson, so it's like Metro West, way outside of Boston. So really all I could squander was for a 500 square foot tiny training studio in Brookline. And I think when you came to observe, you probably saw me training maybe 2, 3, maybe 4 people at a time, in a small space, which is still quite tight.
Yep.
And I think you hit the nail on the head. Like you don't have to open a state-of-the-art training facility with 10,000 square feet and new equipment, and that's nice. But honestly, most people don't care what kind of barbells you have. They don't care that you have fancy equipment. They don't care that you have, red light saunas and cold plunges. I mean, that's attracted to a certain type of clientele, but the type of people that read my stuff or read my stuff are typically the ones that just kind of want to lift some weights and feel better and maybe feel a little bit more athletic. And I knew the type of clientele I was going to cater to. I knew the type of clientele I wanted to cater to. And I bought equipment and a space and had a space that allowed me to do that. And I was there for 8 years. I outgrew that space way before I left it. It wasn't hard to outgrow a space that size. But I milked as much out of that space as I could. And eventually, now my wife and I, as you noted, we're in a much bigger, nicer facility. We moved about a mile and a half away from where I was, but right on a T stop, and it's more collaborative. Like, we just offer more amenities and services rather than just personal training.
Yeah. And so with that simple approach to training, like, what is the fruits that come from that of just keeping it simple? Because I'm pretty sure you had like a squat rack, a barbell, and a bunch of kettlebells when I walked in there.
You're right. I had very minimal. Yeah.
And like, even for us, like, I've been operating my gym now for 4 years, and we just got like a cable machine, like a functional trainer thing, whatever you want to call it. But other than that, it's been barbells, benches, dumbbells, and kettlebells. And pull-up bars.
This isn't to say that there's more than one way to Rome, of course. Like, certainly, if I had the real estate to do so, maybe I would have some selectorized machines and some fancier stuff. Funnily enough, I did get a belt squat.
I actually just was looking at your Instagram and saw that you were talking about that.
So my new facility is still more or less bare bones. Like, now I have 6 pods. So each pod is basically a squat rack, and it has attached to it. Each rack has its own barbell. Each rack has its own power blocks up to 50 pounds. Although I have heavier power blocks elsewhere if we need to go heavier. Each one has like a landmine attachment. So essentially every coach can work with their clients in each pod. And I have a bunch of specialized barbells in the facility as well. I have deadlift barbells. I have a bunch of kabuki bars, safety squat bars. When I opened up the new facility, I wanted to keep the same vibe, quote unquote, simplicity. And on my B list was like stuff I want but don't necessarily need. The belt squat was on there. And it just so happened last summer, a friend of mine who was another gym owner was going to be expanding. The expansion fell through. He had a bunch of equipment that he bought that hadn't been used yet. And he was like, hey, I'm willing to sell you this belt squat unused at a reduced rate. I was like, fuck yeah, let's go.
There you go.
And that's really the only piece of selectorized equipment that I have that's not barbells or free weights. And I also have anchor attachments, which are just save me a ton of space, and I love that product as well. And I don't know, I'm just old school. Like, how I grew up training was with barbells and dumbbells. I like barbells and dumbbells. When I was at Cressy Sports Performance, that's what we used. When I was an athlete, that's what I used. And they work. Like, almost every year, I'll get contacted by a magazine or some website at the beginning of every year, asking me, hey, what do you see are the new trends that are going to be popular? And certainly if we go on Reels or TikTok, there are a lot of trends. But I'm just like, hey, barbells and dumbbells still work. They're not, I feel, and they're more accessible to most people. Most people don't have access to fancy trends and equipment, but most people can get access to barbells and dumbbells and kettlebells and bands. A lot of people, especially during the pandemic, they built their home gyms with barbells, dumbbells, kettlebells, and bands. So I just think it comes down to what's accessible and what's maybe, for lack of a better term, least intimidating to people. Although barbells can be intimidating, I totally get it. But it's just they've always worked. So that's basically how I operate.
And I think it's Yeah, people think they need to go to this big fancy like bodybuilding gym to use all these machines and everything. It's like, no, you're actually probably going to get more out of less with learning how to use a dumbbell, learning how to use a barbell, learning how to use kettlebells, stuff like that, and becoming better.
I was just at a workshop a couple weeks ago with Pat Davidson here in Boston. And he's someone who, his brain just works at another level than a lot of coaches that I know. Yeah. He's just more cerebral and just thinks about things in a different way and looks at things in a different light. And he's about as meat-headed as it gets. Like he uses barbells and whatnot, but a lot of his workshop, which he calls rethinking the big patterns. Yeah. I mean, he leans into using equipment, benches and cables, and setting your body up in a way that accentuates targeting certain muscles, and which I can appreciate and can respect, because some people have more of a aesthetic focus or a bodybuilding focus, which of course being a little bit more honed in on that front is key. However, I'm sure you can relate to this. Is like when you're dealing with general population clients and athletes who are either geared more towards, okay, I got to get ready for a competitive season, or I just want to be able to play with my kids and not crush my back when I'm carrying a bunch of groceries or whatever. We don't have to get that cute. Like we can get a lot done with basic equipment.
Just move.
Yeah, exactly.
And so a couple of the big things I wanted to go through with you today is you've been at this for a long time. You've been very successful. You've hung around a lot of smart people in the field too. So actually you're the third member of the Cressy team to be on the podcast. So I had
the third and last. I get it, Brett.
No. We go from small to big. So we had Greg on first, Greg Robbins.
Yep.
Then I had Miguel on.
Yep.
And now you. So now we're going to the top of next. Next
good luck getting Eric.
Yeah, we got to grow this. You got to help me grow this podcast bigger to get Eric on.
I can't tell you how many times people ask me, "Hey, can you let Eric know I'm trying to get a hold of him?" I'm like, "Listen, I have a hard time getting a hold of him too. So good luck."
But you've had a very successful career in this, and there's so many things that change, especially on the PT side of things and the pain science and the biomechanics that have gone back and forth. So I kind of want to talk to you about some of that stuff today. So a big thing in the rehab side of the field in the past few years has been this whole thing about deadlifting with a rounded back.
Yep.
Is it good or bad? And a lot of the science says that deadlifting with a rounded back is okay, that you're not going to break yourself under flexion, and that you can, flex your spine up to 80 degrees under load and be okay. The caveat being, we don't really clinically, or in person, we can't say what 80% is. Just visually, we have no idea what it actually is, because our reliability of that is so off. And then, you talk to a lot of coaches and it's like, no, I want my people deadlifting or know how to deadlift with a straight back.
Yeah.
Around, okay.
Yeah.
So I kind of want to pick your brain on this one a little bit.
Well, there's nuance to it, right? I say it with tongue in cheek, but the correct answer is it depends.
Yeah.
I mean, and I know it's very cliche to say that, and I came up in the industry in a time where Dr. Stuart McGill's work was very profound and very revolutionary. It really dictated a lot of what the industry felt was the correct way of what proper biomechanics were and proper loading of the spine was. And I do still feel like that his information and his research has a very good and proper hold on the industry. However, I do appreciate and respect the other side of the fence as well, and that the human body doesn't live in a laboratory, right? We live in real life where we do have to move through planes of motion, and we do have to bend our spines in certain ways to live and function and play sport and whatnot. When it comes to rounding of the back and deadlifting and squatting and loading it, I do feel Davis's law and Wolff's law come into play. with rehab. So, that's usually my answer whenever I'm, corresponding with a therapist or a physician, and maybe we're sharing a patient or a client, for example, and maybe they have low back pain or knee pain or a shoulder, pick a joint, pick a part of the body. And I'm always saying the reason why I will advocate for strength training is because of Wolff's Law and Davis's Law, which state, Wolff's Law is if you load soft tissue, that soft tissue is going to adapt to the load you place upon it. Davis's Law is the same thing for bones. If you load and place load on, or they're switched or what, Wolff's Law, either one, you know what I mean.
Yeah.
But both state that whether with soft tissue and bone, you load them, those tissues are going to adapt to the load that's placed upon them. Mm-hmm. And to me, that is rehab. I feel that is the key. With when it comes to loading the spine, my preference as a coach in the very beginning stages of working with a client who has never done either of them is I'm probably going to err on the side of caution and try to keep them in as best alignment as possible, and keep them safe as best of my ability. And then at some point, they kind of earn the right to deviate. They earn the right to maybe flex their spine a little bit or wiggle this way or wiggle that way. Let's be honest too, we don't have microscopic eyes. The spine is moving. It's not just stiff at all time. It is moving. And of course, as load increases with a deadlift, with a squat, it becomes harder to maintain quote unquote neutral spine. So, and I think there's a lot of value in people understanding or discerning the difference between a quote unquote good position and a compromising position, and what the difference is between the two. And that the stronger somebody gets, of course their back is going to round a little bit. I remember when Eric and I were coming up and he was competing in powerlifting. He competed at, I think, the 160 to 166 range body weight, but he was deadlifting 660 pounds. Yeah. And, when you're pulling that much weight at that body weight, your back is going to round and to some capacity. And it's but he earned that, right? He trained his body, he trained his spine to be able to withhold and counteract that amount of load on the spine. So he was safe. So I just think the argument that, okay, the spine has to stay neutral at all times, okay, we can round our backs, there's just nuance to the answer. I think both are correct. But to me personally, as a coach with my clients, my preference is to say, okay, I'm going to keep you as strict as possible up to a point. And then, you get a little leeway the stronger you get and the more experience you get. I think that makes sense to me. It definitely makes sense to me, but I think when I explain it that way, most coaches are okay, that makes sense. I'm not gonna, I have people I've been working with for 2, 3, 4, 5+ years, and when I watch them deadlift and they round their back a little bit, I'm fine with it, because I know they've put in the reps. They're probably not going to hurt themselves. If someone's brand new, I'm probably going to be whoa, okay, hold on, I'll take a video. I'll be okay, see that spine position, that flex spine, let's try to avoid that for now. Let's try to keep you in a more neutral position, which is this position, and then we try to really hone in on that position. And then as they gain more experience, they get a little bit more leeway. So that's how I look at it. Maybe there's people that would disagree with me, but
there are.
Yeah, but I think I'm not going to go out of my way out of the gate to tell someone, let's round your back on a deadlift. I understand Jefferson curls. I implement them as with anyone else, and I do think there's a lot of value now, and that's one of the things I've changed my mind on. If you looked at my early coaching career, I was pretty strict. Spine doesn't move. The objective of our core is to maintain stable spine. We got to be able to move our extremities, but the spine stays stiff at all times. Now I'm I think there actually is a little bit of value in sprinkling in some Jefferson curls or side bends, or allowing the spine to move side to side and flexion and extension. Under load, yes, too, but to a point.
Yeah. We don't know that breaking point.
We don't. So I just think it comes down to experience and reps with a barbell, dumbbell, reps under load. And the more I work with somebody who has that, the more comfortable I am giving them a little bit more runway to get into a compromising position, if you want to call it that.
Yeah. One of my thoughts on it that I've kind of drummed up in the past years is something I kind of think about with it is what we see with the data on back pain is it's not that people have core weakness or lack of core strength. It typically is a core endurance issue and a motor control issue. So they don't know typically how to brace or where they even are in space and time. So a lot of times when I'm coaching it, it's a matter of getting them or being able to create more sense of awareness of where they actually are.
Yeah.
And sometimes that is exposing them to different positions. And when someone has that, they've kind of earned that right to then flex the spine but I also want to make sure they have an understanding of where they are and like reflecting after a heavy rep or heavy set and being like, yeah, I felt my back round there. It's like, okay, cool. Glad you felt that, because the person that has no idea where they are in space and time is, in my mind, anecdotally going to be the one that's more likely to get hurt.
Yeah.
Just doesn't control that. And there was a very...
And to that point, Brett, like I think in the beginning stages when I'm working with a client who has a history of low back pain and they're new to strength training, I will take the old school McGill approach. I'll do the McGill 3, like I'll do pull-off presses. I'll get them to be aware of what their spine is doing and be like, okay, what does stable feel like? And then eventually I will allow a little bit more leeway. And then, okay, now we're flexing, now we're extending, now we're side bending. I mean, to me, that seems like a pretty logical, to me, that's just a way of progression. I'm sure, there are coaches out there that will take that and be like, oh, that's bullshit. I think there's a bit of fear mongering out there to a degree. Like I saw a reel the other day of like I don't know if he was a chiropractor or a doctor of some sort. It's like, you saying if you have low back pain, you shouldn't bend your spine at all, like to touch your toes. Like that's an unstable position. I'm like, what the fuck? Like, are you kidding me? Like that's fear mongering 101. I mean, that I can't imagine what goes through someone's mind who's in back pain. Oh my God, I can't bend my spine at all. Like I'm in that's a dangerous position. No, it's not. Like we do that all the time. Like that. So there are like very grotesque degrees of like sensationalism with that, which I feel is a bit overboard. But when I'm working with clients in my gym, I do say, okay, let's go old school McGill here. Let's just learn what the spine neutral is and like what your spine feel. I want them to be able to feel like what it feels like to be in a quote unquote safe position. And then we're gonna explore outside of that. So that's they tend to get better. I mean, it works. I mean, but then but at the end of the day, like, that's just me staying in my lane. Like I'm a personal trainer and a strength and conditioning coach. I'm not a physical therapist. Like I'm not doing manual therapy. I mean, there are a myriad of ways to treat any type of diagnosis. So I'm just using the weight room as my tool, and there's only so many things I can do. But I feel like my role as their coach is to teach them and give them some competency and what their body is doing and feeling what their body is doing, and then we progress, week to week, month to month.
I will say there are some instances where, just for people out there that listening, so we don't get the wrong idea, there are certain instances where maybe flexing your spine, especially under load or against gravity, is not the best idea. Like if you have a herniation or some type of disc and nerve entrapment, it might not be good. Other times it is really good. If you have stenosis, it's the opposite. If we don't want to really extend the spine, we want to be flexed. So there's always context specific
Sure.
pieces to know and understand here, just for those listening that might have back pain. Like, it might
And
be
then
okay
also, if I'm doing a session with someone and I say, okay, we're going to do this specific exercise, pick one, I don't care, and it doesn't feel good to them, I'm not going to force it on them. Like, even though the textbook and the research says otherwise, like, this is the one, like, I can't be that steadfast in my thinking that, I can't force feed, everyone's different. Everyone's anatomy is different. Everyone's tolerance for pain is different. And that's an ongoing conversation when we talk about pain. Like you mentioned pain science.
Yeah.
Certainly not my area of expertise, but, via my relationship with guys like Dan Pope and Mike Reinold, I am, and the people at Back Bay Health, Tim and Laura Latham, which are right on Boylston Street, right in the city. I am comfortable having conversations with my clients about, like, on a scale of 1 to 10, 10 being the worst pain possible, 1 being not a big deal, like where are you at? And they'll tell me. And to me, the green light is 3 to 4. If they're in a 3 or 4, like, I can live with that. Like, the expectation shouldn't be like avoiding pain at all costs, no matter what. Like, there should be zero discomfort. Once they get into 5, 6, 7, 8, 9, 10, then yeah, that's a red flag. That's a red light, and we need to change things up. We have to go to plan B, plan C, plan D.
And my thing with those things too, like, if it's a tendonitis or tendinopathy, yes, like, those things we know we have to work through some pain.
Yep.
We should be managing our volume very well and tracking our symptoms, pre-post session for at least 24 hours. But my thing is still, as much as I do know about pain science and things, it's like, okay, we can do this exercise. Like, what are we doing it for? Right. And then, well, is there a way we can do it without pain, or a variation that's not going to cause us as much pain? Let's do that instead. It seems like there's a lot of, like, coaches and PTs out there now that are just like, keep training through it. Let's bear down. And it's like, okay, we can, I guess, slowly desensitize the system. But the thing with that too is, like, all the research on motor control shows us once pain is introduced to the equation, motor control changes. So are we making our, motor patterns and force outputs less optimal by continually training through pain all the time? And I don't think we have a good answer to that question, where it's like, all right, overhead press hurts, let's do a landmine press. Squatting hurts, let's try a box, let's try a SSB squat, let's try a Duffalo bar, let's change your foot stance. Like, let's do any of those things so you don't have to train in pain. Because I think that's one thing. People are learning a little bit about pain science, but they don't know enough about it.
That's my lane. You just hit the nail on the head as far as what my lane is. I view that as a modifiable factor. So Travis Mash, Michael Mash of Barbell Rehab.
Oh, okay.
Travis Mash too. Like, he's a smart guy as well. But Michael Mash, like, he'll talk about that as a modifiable factor. So, like, if a barbell back squat hurts your back or knee, then yeah, we can, to your point, maybe we go to a box, maybe we alter our width of our stance, maybe we go with tempo. Like, okay, I feel like tempo is an underutilized training variable when it comes to deadlifting, squatting, bench press. We'll say the big 3. Slow down the rep so we can make a seemingly light load much more challenging by using a tempo, 3 seconds down, 3 seconds up, or 5 seconds down, whatever, to make it more tolerable to perform. So they are still deadlifting, they're doing a hinge, they're doing a squat pattern. We're still loading the tissue that needs to be loaded, but in a way that's not hurting, past a certain point. So, I call that the trainable menu overall. Like, it's a term that I got off of listening Mike Robertson's podcast, and seem to have adopted it, throughout the years. Is like, okay, let's not focus on what you can't do. Let's focus on what you can do. Let's find that trainable menu, and then I refer out to the more, like, if it's a motor control, they just need more, like, nitty gritty corrective stuff to do, I send them out to the physical therapist or the chiro or whoever, manual therapist, to get that work done. But then my job is to say, okay, you're coming here, because a lot of times people, when they come to train in general, you know, a lot of it is a stress relief. It's a psychological relief. Like a lot of people, when they can't train because they're hurt, it does affect them psychologically.
Yeah.
And you have to take that in consideration. And you take someone who leads a very active lifestyle, whether it's, you know, lifting weights or whether it's running or just whatever, you take that away from them, like it's going to have negative effects in other ways. So and
then the other thing too, like I'm experiencing now, I have like really bad cam lesions in both my hips.
Yuck. Yeah.
And probably some labral tears and some really like bad FAI, and being an Olympic weightlifter, like those things don't mix that well.
No, yeah, sorry to hear that.
And so,
Oh,
yeah, I'm contemplating surgery, but the outcomes aren't that great for it.
That's a tough call.
It's like, all right, do I, you know, I'm not motivated to do weightlifting anymore because I just repeatedly go in and I'm in pain every time I do it. And I was like, why do I keep doing this? Like I could just not do this and not live with as much pain. And not that it's like searing pain all day, but it's like just, you know, my hips are sore and stuff for a few hours after a session. But it's like I'm not making it any better by continuing to do it. Where, same for anyone that's like, if we continue to tell people that they should be showing up training through this pain, at what point does their motivation change and they don't want to keep training anymore?
Yeah.
When we could have just modified it where they could come in, have a successful session, have a better cognitive association with exercise and movement, and be able to go on living their life, not limited by the fact that they thought they needed to just work through, you know, the barbell back squat or whatever.
Yep. And that's where stuff like specialty bars come into play here. So, you know, I take someone who's a competitive powerlifter or was a competitive powerlifter and still likes to train with barbells, but the barbell hurts their back or hurts their shoulder. You know, okay, safety squat bar, yoke bar, you can still squat. Now your shoulder isn't on fire. So, you know, again, finding, I really try to ingrain in other trainers and coaches, like especially when I'm doing workshops and when I'm coaching or when I'm serving as a mentor to somebody, you know, really it behooves you to find these modifiable factors and stick to this trainable menu mantra with your clients, because your clients are going to appreciate that. And plus you're teaching them that it's okay to have your shoulder hurts, knee hurts, doesn't mean you have to shut it down entirely. It just means you have to, you know, take care of that injury, like in whatever manner we need to do it. But then you can still train the other parts of your body, and still get a lot of benefit out of that. So, I lived that myself when I ruptured my Achilles a few years ago. Like I couldn't stand. My right leg was out of the equation for many months, but I still had a left leg and an upper body I could train, not to mention a posterior chain. So, and that's exactly what I did. And then when I eventually started rehabbing and got through rehab, I feel like I rebounded back much more quickly than if I didn't do anything.
100%.
So I really try to instill that with my clients. Like my clients come in all the time. I mean, in Boston, I work with a lot of people who are endurance athletes. They run. So I'm dealing with a lot of hip stuff and stress fractures and knee issues. And I'm just trying to showcase to them, like, listen, we can still train through these things and address the issue, but at the same time get stronger in other areas while you're trying to get better. And you're making your clients more competent, which is a very powerful thing, because eventually I like it when my clients are able to coach themselves and able to maybe back off from training a little bit. Because I've taught them and I'm teaching them how to train and how to load. You might remember Tony Bonvecchio.
I know Tony. I see him at powerlifting meets all the time.
Yeah, so you know I remember listening, and I don't know if it was in person or maybe it was like something I read that he wrote, but he's like, listen, we have to teach our clients how to load themselves, not just tell them how to load themselves. So my my objective as a coach, sure, in the very beginning, when people have no idea like what the fuck a kettlebell is compared to a dumbbell, they're like, what's the difference? Like, yeah, I gotta tell them how to load themselves. I gotta tell them, okay, grab that dumbbell, do this exercise, do that many reps with it. Okay, in the next set, stay the same or go up. Like, I'm telling them. But eventually, you get to a point where you start sprinkling in the RPE system or reps in reserve, or you start sprinkling that in, because now it's like we're teaching them how to load themselves and what an RPE actually is and what it actually feels like. What is an RPE 9? Like, what is that? So you got to eventually teach them how to load themselves, and then eventually they get it, kinda.
Yeah.
And then we get into conversation of like, okay, what do you feel on that set, and what do I see as the coach? Because even that can be two different things. Like, they might think something is an RPE of 6, but that looked like a 10 to me. Like,
I have some clients like that, and then you have some on the other end of the spectrum too that think it's an 11 and it's like a 6.
Yeah. So I think, I mean, that's another nuance of the coaching relationship, and like working through pain and training around pain is like, telling them how to train and how to load themselves, and teaching them how to do it. So that's another big rock coaching mantra that I try to instill on other younger coaches as well.
That's something I do too. Like, a lot of my staff that are coaches, of like, if they take over some of my athletes or something at some point too, I'm like, all right, like, look, Abe's always going to overshoot, and sorry, Abe. So I specifically will be like, Abe, your RPE might be a 6. I know it's going to be an 8. I plan on it being an 8 if I give him a 6. It's like 2 points. He's like +2 of a handicap. And then, the other person might be, they never want to push themselves. So I might have to take someone. I'm not going to, shout out to my people that are underworking, but I might have to give someone a 9 and expect a 7.
Yeah. Yep. And, well, that's the thing too. I mean, some people just underestimate their actual strength in the very beginning, and that's
even long term.
But to your point, a lot of it's just a personality thing. Like, I mean, there's just even throughout the years, like I've been lifting weights for over 30 years. And I would say now I'm in a phase in my life and with training where it's like, I still like to push myself. Don't get me wrong, but honestly, if I'm being honest with myself, like, I get to the point where I'm doing a set of something and I start straining a ton. I'm like, I'm good. I'm done. Like, I don't need to like go to an RP of 10 every single time. It's just those days are past me. Like, I've earned. The nice thing about if someone who's been training for a long time or has built a nice base of strength, is it doesn't take a lot to maintain it. I mean, it takes a lot of work to get to that point, but once you have it, really you just kind of every now and then got to remind the body of what it feels like to do a one set to failure every now and then, or maybe, do a heavy single at 95% or whatever. And it will maintain strength pretty well. If you do that, you don't have to, make every single set a life or death situation. But I just think that just comes with experience and wisdom, maybe. But you're right though. Some clients, it's just their personality. They're just not going to push themselves, and I'm not going to force them to, unless it gets to the point where it's like, listen, if I know what their goal is, or they're training for something, or maybe there's a certain injury that they're trying to work past, and I know they're not like working at the level they need to be working to like get there, then I might be a little bit more of a hard ass on it and put it on them, and be like, that's where having a wife who is a psychologist comes in very handy. Is that I can be a little bit more tactful with how I approach that, rather than me being old school Tony, like, what the hell, you're not lifting hard enough, come on, let's go. Like, that's not the answer for a lot of people. You got to be like, I'm curious, when we first started, you said your goal was you wanted to get out of low back pain, or you wanted to be able to do a 9-minute mile. Like, I remember that being your goal, but I'm looking at your training and it's not really matching, like, so there's ways to put it in a way where it's a little bit on them. Like my wife will say, I always hear her say that this phrase, I wonder, or I'm curious, or, like if I preface my sentence with that and be like, I'm just curious. I remember you said what your goals are, but then I look at your effort and it's just like, what are they? Have your goals changed? You know, there's ways to be a dick about it without being a dick about it as a coach, but but you're right. I mean, sometimes it's just, I mean, who am I to say? Like, some people just want to come to the gym and say they've been to the gym and like they want to do a little bit of work. And there is don't get me there. You and I both know there is a community or relatedness element to training. You know, that's one of the cogs of motivation is autonomy and competency. Like, autonomy meaning people want to have they want to be able to not feel stupid. They want to know that they can do something. You know, which is why I don't have people do a barbell back squat on day one. I start with a goblet squat, and then we kind of progress our way up. You got to build some autonomy. They want to be able to do stuff on their own volition. Then you got to build some competency, and then there's community, there's relatedness. So one other element of motivation for clients or for people is having a sense of community, which is why going to the gym is part of what keeps them motivated. So, you know, sometimes a client, that's their motivation to go to the gym, and just be around other cool people that are like-minded and getting after it. Doesn't mean they have to, that their goal is to hit a 3 times body weight deadlift. They just want to be around other people who are doing that. I don't know. So, you know, when it comes, like, motivation is always a big interest of our industry, right? How do we best motivate our clients to get the results and goals that they're after, you know, and we have to find where on that autonomy, competency, and community table that they are. We have to meet our clients where they're at. So
I was reading this blog of yours, and this is actually something I wanted to talk about too, is helping people, or, you know, letting people find their motivation. And you made a very interesting point in that article saying, you know, we expect, or our expectation is, people come to us and want to pay us so they don't have to think about it, and we're the experts, so we tell them what to do. But internally, people do want to have a say in what they have to do.
Sure. Well, they want choice, right? I think a powerful component of motivation is choice. And that's actually, I got a little bit backwards, that's actually autonomy, is giving people choice, having a say on what's happening. So, you know, so I'm all for, not at the very beginning, of course. I think in the initial stages of the coach-client relationship, I'm the boss. Like, they're coming to the gym, like, I'm doing the assessment, I'm addressing their injury history, I'm looking at their goals and their ability level, I'm designing the program, we're doing that. And in the very beginning, most people need the same stuff. Like, everyone's going to start with the goblet squat, they're going to do some push-ups, they're going to do a row, whatever. I think eventually, at some point, there's a lot of value in giving people some autonomy and giving them some choice in their sessions. So, meaning, you know, I have some clients that just don't like deadlifts, or they don't like squatting, or maybe they don't like trap bar deadlifts, but they still like deadlifting. So I was like, all right, well, let's do a landmine deadlift, let's do a kettlebell deadlift, let's do a straight bar deadlift, who knows? You know, if that's going to get them more motivated or ramped up for their session, let's go for it. You know, I have some clients that come in on a session and I could just tell they're beat down. They had a long day at work, they didn't eat all day, they had a poor night's sleep, you know, but on their program it says, okay, we got to hit a 1x5 deadlift today at an RPE 9, and then we're going to back off a little bit and do 4 sets of 5 and it's like, they're just like, ugh. And I have to be like, okay, we got to pivot. So you get a choice here. We can do this or that. And if they, whatever they choose is what I'm going to lean into and be like, okay, if that's going to get you to have a good session and motivated to work, then I'm going to lean into that. Why wouldn't I? So, as the coach, why wouldn't I lean into that? You know, assuming that they're not going to hurt themselves and do something chaotic and stupid. But so I think, you know, when it comes to motivation, giving people choice can be very powerful. So whether that could be a multitude of things. Like, again, it could be choosing the main lift of the day. So whether it's, all right, a squat, deadlift, bench press, heavy chin-ups, whatever, choosing the modality. So what type of squat they're doing, what type of deadlift they're doing, I don't care. I just want them to lift something heavy. Like I mean, I have a neon sign in my gym that says lift heavy things. It doesn't just say barbells. It says things. So I don't care. Like, I mean, you and I both know, and most people listening know, that the body doesn't differentiate between a barbell, a dumbbell, a band. It just views tension and load. So, and in the end, I don't quite care like how it happens, as long as it happens. And then sometimes at the end of a session, if they've done their entire session and there's time to spare, okay, let's choose. Like, you want to do some direct arm work? You want to do some extra glute work? Do you want to do some conditioning? We can do some kettlebell swings, push the sled, do some heavy farmer carries. What is going to fill your training love tank to finish off your session? Giving them choice is a very powerful component. And you want to help your clients work harder, give them a little bit more choice. I think is a nice thing to keep in your back pocket.
How long ago did you kind of make this philosophical change, I guess?
Not coincidentally is when I started dating my wife.
I read that in your article too, yeah. And she's a psychologist, right?
I mean, maybe at some point I would have eventually gotten there. I think dating her while she was finishing her PhD, and then as she went into her world, I can't tell you how many times early in our relationship, when I come home from Cressy Sports Performance, that I would confide in her and be like, I have this one client, just they always complains about this, or just isn't motivated to do that, or really tries to like train hard through an injury. Like, I can tell they're squatting and they're gritting their teeth and they're grimacing, but they're saying, "Oh, I'm fine." Like, what do I do? Like, and so, it was nice to be able to like get a psychological or psychologist's viewpoint on human behavior and human feelings, and not just be like the meathead strength coach. It's just like, oh, put more weight on the bar, that'll solve it. So
what are the big things she's kind of taught you and changed her mind on, as far as how has she influenced your coaching career, I guess?
I think a lot of it's the self-determination theory of motivation. Like, I mean, autonomy, competency, relatedness. Like, every time I start with a new client and I'm thinking about motivation, like what's going to get them motivated to stay. Because at the end of the day, results come from consistency. Yep. It doesn't really come from like the perfectly written program or the perfectly executed squat. Those help, of course. That's what people pay us to do. But at the end of the day, I'm trying to find out what's gonna keep that person most consistent and on point. Because the more consistent somebody is or are, the more likely they're going to get the results they want, and the more likely they're going to attain their goals. So I do think number 1 and number 2 and 3 are probably just the self-determination theory. Trying to figure out where or what cog is going to resonate best with each client. Sometimes it's all three, of course. There's a little bit of all three. It isn't just a hard 1, 2, or 3. I'm sure there's a Venn diagram of like all three components and like where the sweet spot is for everyone. But also, I think just becoming a better listener. I can remember early in my coaching career, I would be the one that would be trying to impress the person with big words like reciprocal inhibition and undulated periodization and like using actual terms of the muscle. Like, they don't care. They do not. So learning to just do more listening as a coach, and but also being real with people too. Like, a good example that I learned from my wife was that I have a lot of clients that throughout my entire career would be like, oh, I should look a certain way, or I should be lifting X amount of weight, or I should be doing X program. And my wife will say, they're shitting on themselves. Stop shitting on yourselves. Like it's a made up story that you're telling yourself that you should look this certain way. You know, social media has not helped in this regard, by the way.
No.
You know, so I mean, if anything, it's more relevant now than when we first started dating. You know, where I was like, listen, you're saying that you should do this, you should do that, you should look a certain way, you should be eating a certain way, whatever. That's a story. You're making it up. No one is telling you should do that. Like, my goal as your coach is like, what are your goals? What's gonna keep you consistent? We need to focus on that. And so sometimes just being a better listener and like just being a voice of reason with clients has been and athletes has been a very powerful tool that I've learned from being married to a psychologist. You know, so you know, she's got a course, of course, that's geared for fitness professionals, because I think psychology, you know, that is something in our industry, whether you're a personal trainer, a physical therapist, a nutritionist, whatever, you are a psychologist. Yes. You are dealing with people's thoughts and feelings and motivations, and that is something that we are not educated on at all. Really, like in terms of like, you know, textbook stuff. I mean, some of it is intuition. I mean, some people intuitively are very good at reading people and like are very good at they have very good soft skills. But you know, when I started dating my wife, and as I progressed in my career, I found myself leaning on her a lot, or relying on her a lot, as far as like how I interact and communicate with my clients and my athletes. And lo and behold, you know, she eventually released a course and just released volume 2 of her Psych Skills for Fitness Pros. So, which is information that is for coaches and personal trainers to better motivate their clients, or how to deal with boundaries. I mean, that's a huge component. Like, how do you deal with clients that are energy vampires and take a lot of your time and expect you to answer their email at 9 p.m. or, you know, I work in a semi-private model, meaning I'll start all my sessions one-on-one. Their assessments are one-on-one, but eventually everyone is in a semi-private model where I'm coaching anywhere from 2 to 5 people at the same time. They're working off their own programs. However, in that system, throughout the years, one problem that I've come across, not a lot, but it happens, is I'll have one client that just expects my time the whole hour. Like, look at me. Well, how's this look? At the expense of me being able to coach the other people, right? So how do you set boundaries? Like, how do you communicate boundaries with clients? You know, like, because I think we as an industry are very programmed to think that we're you know, we should answer that email at 8 p.m. at night because our client has a question about what a certain exercise is or what they're doing tomorrow. Or, no, you don't. Like,
answer tomorrow.
So that, you know, having, I mean, that's another component of what she covers as well. But in volume 2, I believe she just releases more about the coaches. Like, it's all about your mind. Like, you know, we're a service industry. Like, we want to help our clients and we want to help them thrive. But what about you yourself? Like, what's going to help you thrive? Like, one thing that especially when I started dating my wife, was learning the crucial importance of a work-life balance. Like, don't get me wrong, like, I will definitely advocate for people, especially early in their career. You need to work your ass off. Like, it's not just going to just happen. Like, get off this idea that having a bunch of followers and likes on Instagram is going to give you long-term success in this industry. It doesn't mean jack shit. It really doesn't. Nope. You know, what's going to get you you know, like a footing in this industry and a reputation in this industry, and you want to be financially sound in this industry, is being a good coach. And being a good coach comes with repetitions. You need to coach a lot. You need to coach a lot of different people, a lot of different personalities, with a lot of different goals and a lot of different injury histories. And that's the only way you're going to get better. And then that in of itself is going to get you a little bit more freedom down the road, where then, you have a little bit more of like a work-life balance. You know, because of course, as you get older and you get married, you have a kid, you know, maybe you change, maybe you want to become a massage therapist. I don't know, who knows?
Yeah.
You have to have a work-life balance. And one thing that I feel like I've been able to do very well is being able to shut it off when I need to or when I have to. Like, you know, when it's time to spend time with my family, I'm with my family. When it's time to watch, you know, Netflix, it's time to watch Netflix. I love movies as much as the next guy. I often joke, if I weren't a strength coach, I'd be a movie critic. Like, I need some time away from writing programs and answering emails and doing continuing ed, away from that, and have a life outside of that. I think it's very important to have a life outside of always thinking about Mel Sif and like what and strength curves and, you know, breathing patterns. I think that's crucial.
Yeah, absolutely. And I think there's like a whole emotional burnout side to being a coach and working with people all day.
Oh my God, yeah.
You don't realize until you're too far gone that like you've surpassed that limit and you're like, shit, I saw a meme actually the other day. I was like, yeah, my body's check engine light has been on for months now, but I'm going to keep going and just, you know, work through it and ignore it.
You know, I think one thing I still struggle with as a coach is not taking it personally when a client exudes frustration. Maybe they're not getting the results they're getting, or maybe their knee isn't getting any better, or whatever. It's hard for me not to take that personally.
Yeah.
As their coach, because like, oh my God, this person's paying me to write their programming and coach them, but they're not getting better, they're not getting results, but they're still coming to their sessions. You know, so that's still something that's hard for me to deal with. That does drain a lot of my emotional, like, I was like, oh, what am I doing wrong? What am I doing wrong? I have to do this. I have to fix this. When I don't know what else is going on. I don't know what they're doing at home or what they're doing outside of. Are they really being consistent with their homework that they're supposed to be doing? Like, what other factors come into play? We all know other factors come into play when it comes to pain. No, not to circle back on this, but it isn't just strength training. I mean, there's stress, there's sleep patterns, there's nutrition, there's a lot of psychosocial components of pain, of why someone might be hurt.
Or just frustrated, but it's like, it's totally a thing of, I think that's my biggest thing too, of like the fear of letting someone down or not giving them what they paid for, even though.
Sure.
And luckily I had my mentor, Ramez. Do you know Ramez Antoon? He used to hang out with the Cressy guys.
I recognize the name, yes.
Yeah. Neuropedics. He was in Somerville for a bit, but he always told me, he's like, are you letting this person take the monkey off their shoulder and put it on yours? And it's just
that's a fair point. Yeah, that sounds like a very Lisa thing to say. My wife.
I was like, oh yeah, you know what this person is? It's like I'm showing up every day. I'm giving them the advice they need. Like I've started to view myself more of, and this is also from Ramez, of like, view yourself as a financial advisor. You are the guide. You can tell them, here's your low risk profile, here's your high risk profile, here's the risk, here's the reward. You have to choose what to do with that. And at the end of the day, if you want to show up and work hard, like, I'm here for you, but if you don't, like, I can't make you work hard.
Yeah. And that comes with time, I think. I think there are a lot of with coaching experience, you eventually get there.
Just takes a while, and it takes
a while. Still, but I think the sooner you're hearing these messages and you're reading about these messages and hearing other coaches say it, the better. Yeah. I mean, certainly no one was telling me that early in my career. Like, no, zero. Like, no. So, but yeah, I think, it's there's needless to say, there's a lot to coaching.
And it's like, okay, what could I have done to make this person better? There's a million different things. And then you could sit there all day on that topic.
And I know my wife has said this before too, because when I've had clients in the past who have expressed frustration or whatever with not frustration with me as an individual, but just in general. Oh, I still haven't lost those 10 pounds, or I still haven't whatever. You know, she made a good point too. She's like, well, are they still coming to their sessions? And I'll say yes. And she's like, well, then they're obviously getting something else out of working with you that is fulfilling their needs, other than just losing the 10 pounds of fat or just, being able to deadlift 2 times body weight or whatever it may be. So I was like, and that was a nice reframe too. It's like, they're still coming, like they're still coming once a week, twice a week, whatever. So there's something there as well. So you have to remember at the end of the day, it always isn't just about the finite goals, like, losing 10 pounds of weight, lifting X amount of weight, whatever. There are other benefits of physical activity and going to see your coach than that. So absolutely. And I think the more coaches can lean into those soft skills of coaching, the better off they're, the more holistic or more well-rounded they're going to be overall.
The last thing I want to talk about here before I have to wrap up, you wrote an article before about the lost art of saying I don't know in the fitness industry. Yeah. And that is a big one I see all the time, especially, and this is something I just kind of warn people about of, I had a conversation with someone a while ago, like, yeah, this person just get their personal training certification, they're jacked, and my mom's going to go see them. I'm like, well, why? And they're like, well, because they're jacked. I'm like, cool, but what do they know about actually training people? Mm-hmm. And I work out in a commercial gym from time to time, and I'll overhear some of these conversations trainers have. I'm just like, what the fuck did you just make up? Like, what is that language you just used? You have no idea what you're even talking about, like in the simplest of forms. And it's really something I hate about our industry is, there's so many trainers that say everything with this absolutism to it, and it just drives me crazy.
I don't know where I got it from. I didn't come up with this, but there are 3 words that are immediate red flag to me. That is very profound in the fitness industry, and the wellness space in general. Is anytime someone says everyone, never, and always.
Yep.
So meaning everyone should deadlift. Yep. You should always avoid carbohydrates or any food that you can't pronounce without without alphabet soup, or never, think of something, never squat like below 90 degrees or whatever.
Joel,
anytime I hear those words, I immediately roll my eyes. I'm like, come on. Or like, everyone should squat with their toes pointing straight forward. Their feet's got to point straight forward. I'm like, not everyone has the same anatomy. Like, that's just preposterous to think that everyone, 7 billion people on the earth are all going to squat the exact same way. Are you kidding me?
Which is crazy because we do have fitness and rehab professionals out there. I'm not going to say names.
Sure.
That have made archetypes of everyone should squat with their feet straight ahead. And
I don't get it, but
some people can. But but people will come in a lot of, not a lot, but a fair amount of injuries come into us, and I'll just ask them like, okay, what are your internal cues you're thinking about, or what are you thinking about with your setup of, say, your squat? It's like, well, I put my feet straight. I'm like, okay, why do you put your feet straight? It's like, well, so and so told me that I need to put my feet straight and that everyone should squat with their feet straight. It's like, okay. And I just like look, and like I have a fairly fucked up nose, and I'm like, does your nose look like my nose? Like, no. I'm like, all right. Do my cheeks look like your cheeks? No. Do we look like the same person? No. Do you think our hips look exactly the same then? Or do you think they might be a little different?
Yeah.
Because you can see the bony structure of the face is like, don't you think there could be differences between my hips and your hips, and maybe we should both squat differently? And they're like, oh, like it's just this huge revelation to them.
Well, I think some people need to be told, they need to be given permission that it's okay to, it's kind of getting off the main thing we're getting to, but asymmetry. Like I'm all for people squatting with an asymmetrical pattern, or one foot, one toe might be more externally rotated than the other, or they might have more of a staggered stance. Like, I think sometimes people need to have permission that it's okay to squat that way, or deadlift that way, or move that way. Yeah. To me, if it feels better and you feel more stable and you feel more powerful and it feels safe, and you're still able to lift whatever weight you're lifting, why not lean into it? Like I'm all for that.
This could be. We need to have you come back on for another episode.
But to go back to your I don't know thing, like at the end of the day, I think there's a lot of power in saying I don't know. I think your clients will appreciate that. So a good example of that is you mentioned weightlifting, Olympic lifting earlier. That's what you do or did, or hopefully can continue to do at some point.
I still coach it, so I'm living vicariously through.
I had a client a number of years ago when I was at Old Core, my old studio, who was training with me for a couple months. And one day she came in, she's like, you know what? I'm really interested and curious in Olympic lifting. Like, what are your thoughts on that? Do you think that's worthwhile to do? And I was like, hey, I think they're great. I personally don't have experience with doing them nor coaching them. However, I do know this great facility within Boston. That's what they do. I think that would be a great fit. She ended up contacting them and starting them, which meant she left me. Like, she left training with me. So I technically lost a client. But she emailed me like weeks later saying, oh my God, I found my people. This is fantastic. I love this. Of course, that made me feel good. But she referred a friend of hers to me. Mm-hmm. So, and I refer people to Ripple Physical Therapy as part of Core Collective. Like, they have a satellite facility within Core Collective.
Oh, cool.
I all the time am referring my clients to Ripple for stuff that is outside of my scope.
They just referred someone to us too, so that's cool.
Yeah, so
small world.
There's a lot. Your clients will appreciate that you have their best interest in mind. When you don't know the answer to something. I have clients all the time. I saw on Instagram this or that, or and if I don't know the answer, I'll say I don't know. I can find you the answer. Like, I know a lot of people in this industry. I can find you the answer. So I don't care if I don't know the answer to it. Like, I mean. No one. I mean, I don't think it's demerit points. Like, 20 points aren't going to be taken from Gryffindor because you don't know the answer to a nutritional question.
Yeah. But I think there's a lot of respect that goes into it. Of like,
sure,
if I'm able to sit here and be humble enough to be like, I don't know, but I'm going to go talk to so and so or research this and that, and I'll get back to you. I think. And
then if you actually do come back with an actual or an email or whatever, and you follow up. Oh my God, you're just building client trust. You're building a good rapport. So I think there's a lot of power and goodwill in saying I don't know, but then following up with it. Like, if you say you're gonna find out, I think you should find out. Like, or directing them, or even just like I said, directing the client to someone that does know the answer. Like. I think it's only going to be like work in your favor in the end.
All right, man. Well, I got to wrap up here. Thank you for your time.
My pleasure.
Where can people find you if they want to reach out to you or
home base? My website would be my name, so TonyGentilcore.com. So that's like where the gym is, services, social media, articles, all that good stuff.
Cool. And then you can go on T Nation and find.
Yeah, I think the last time I wrote something for them was like 2 years ago, but I think my ballpark was 2009 to like 2015 was when I was writing for them pretty consistently. So maybe the content's still relevant. I don't know.
Probably. I mean, a lot of
it doesn't change. Yeah,
it goes back and forth, but it always comes back to the same moral principles. So. All right, man. Appreciate your time. This is a good chat.
No, this is great. Thanks, Brett.
Of course. And hopefully we can get you back on because I do want to learn more about the like your hip and shoulder blueprint that you and Dean do and talk about some of those nuances of squatting and different positioning and asymmetries. Yep. And I'm really curious to learn more about that and have some people learn about it. So
great.
We'll try to get you back on in the near future. All right. Thanks for coming on.
"84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram, or visit ARKITECT fitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.